What if I told you that there's a pill currently sitting on your pharmacy shelf that can significantly reduce your risk of colon cancer? No prescription required, you can just get it right now. Sounds too good to be true, right? Stick around because this is not just another random internet health claim. This one is actually backed by very strong science. Hi guys, I'm Dr. Kidd, a board certified family medicine physician, and in this video, I'm going to go through how aspirin, a simple over-the-counter medication, has been shown to reduce your risk of colorectal cancer. Colorectal cancer is the third most common cancer worldwide, with 1.9 million new cases diagnosed in 2022, resulting in 900,000 deaths. The scary thing is that the cases of colorectal cancer are actually increasing in younger people. The reason why we're seeing increased cases in younger people is still unknown, but this has prompted most screening programs in the world to lower their screening programs starting at the age of 50, now down to the age of 45. This is why in addition to screening, we need to look for treatment options that can actually prevent cases of colorectal cancer. But does aspirin actually help? The answer is actually a resounding yes, backed by solid scientific evidence. It was actually found by accident, where aspirin was initially being studied in its effect in the prevention of heart disease. But as researchers started looking through the data, what they found was that there was a 35% lower incidence of colorectal cancer cases in those that were taking aspirin compared to those that were taking placebo. Numerous studies were starting to consistently show this trend, and more recently, a comprehensive meta-analysis further confirmed this finding. A meta-analysis is considered a gold standard of evidence. It compiles data on all the available evidence on a particular topic and provides a clear quantitative estimate of how effective an intervention actually is. In this case, the most recent meta-analysis analyzed a whopping 45 studies and had over 150,000 confirmed cases of colorectal cancer, making the findings of this study highly robust in examining aspirin's effect on colorectal cancer. The bottom line findings are that patients taking aspirin had on average a 27% lower risk of developing colorectal cancer. But that's not all. The study also showed that aspirin reduced the risk of other cancers as well, including esophageal, stomach, liver, and pancreatic cancer. The study also showed that for all of these cancers, the longer you take aspirin, the greater the protective effects. For colorectal cancer specifically, the risk reduction was approximately 20% after 5 years of use, and 30% after 10 years of use. So should we all go to the shops now and pick up some aspirin? Well, like any treatment, you have to balance the benefits versus the risks. While aspirin is available over the counter, it's important to remember that aspirin still has potential side effects. One of the most important side effects is the increased risk of gastrointestinal bleeding. A large study of 33,000 men showed that those that were taking aspirin had a 36% increased risk of gastrointestinal bleeding. Another important risk, particularly in older individuals, is increased risk of intracranial bleeding, which is bleeding inside the brain. A large study of more than 19,000 adults aged over the age of 70 showed that there was a 38% increased risk of intracranial bleeding in those that were taking regular aspirin. To add more complexity to the risk-benefit analysis, aspirin has other benefits outside of reducing the risk of colorectal cancer and other cancers in the gut. Aspirin has been shown to prevent heart attacks in those that have previously had a heart attack. Aspirin may also reduce the risk of ischemic stroke, which is a type of stroke where there's a blocked blood vessel to the brain, which is a similar mechanism to a heart attack, where in that case it's a blocked blood vessel to the heart. The evidence for this is mixed, however, because it does not appear to reduce the risk of stroke in older individuals. This is a graph illustrating the expected frequency of the key events for 10,000 patients between the ages of 50 to 70 years old over 10 years who take aspirin for at least 5 years. For example, for 10,000 women aged between 50 to 70 taking aspirin for at least 5 years, there will be 66 cases of colorectal cancer over the 10 years, while for women not taking aspirin, there will be 88 cases of colorectal cancer. As you can see, for both men and women who take aspirin, there are less cases of bowel cancer, heart attack, and stroke, but there are increased cases of bleeding from the stomach and gut. Therefore, deciding whether to take aspirin is dependent on the risk and benefits based on an individual's unique situation. For example, if you have a younger patient that has a relatively low risk of intracranial bleeding, has a strong family history of colorectal cancer, and has had a previous heart attack, all of these factors favor this person taking aspirin as a preventative measure. So if you do decide to take aspirin, how much should you take? There's no consensus from the literature as to what is the most effective dose, but dosages from 100 milligrams every second day up to 300 milligrams daily have all shown positive effects in reducing the risk of colon cancer. So in short, whether you should take aspirin is really dependent on your medical history, risk factors, and personal preferences. That is why my recommendation is that before you take aspirin, first consult with your doctor who knows your medical history and can help you make an informed decision. So if you found this video helpful, don't forget to like and subscribe to the channel. It will really help me out a lot. If you want to learn about the deadliest virus on the planet, which is basically 100% death rate, check out this video here, and I'll see you in the next video.